Hi, this is chapter 40 in the MDA book. So this section is going over patient records, ownership of dental records, and digital file security. So patient records, as we've talked about before, are very important documents, and all of the patient records, whether they are conventional film or digital images, when they're taken on, as of x-rays, they're part of the patient's record and they're regarded as a legal document. So the x-rays are not given to the patients. The x-rays, if the patient require a copy of them or require the x-ray, they are given a copy of the x-ray with the doctor's consent. So they are legal property of the doctor or the dentist. Patients do have the right to reasonable access or copies of the chart and of the x-rays. So the doctor will give permission for someone in the office to make copies of these documents and give them to the patient. That's why it's important when we expose x-rays that we have quality x-rays, because if they're poor quality radiographs, it just reflects poorly on the dentist if we're giving them to another doctor or if they're used in court. So you want to make sure that all of the x-rays that you're taking are of good diagnostic quality. So it's very important to document the exposure of dental radiographs, the number of films exposed, as well as the quality of the radiographs. It may be an important issue in a malpractice suit. So if you're taking a full mouth series, you don't want to just write full mouth series or abbreviate it as FMX or however they abbreviate it in their office. You want to write down exactly how many x-rays that you took, because a full mouth series can vary in the amount of films depending on the office that you're in. One office, it may be 14 films, another office, it may be 20 films, depending on how the doctor has the film set up. So it's very important that you know the sequencing that they are taking the films in, the number of films that they're taking for their full mouth, and that you have documented that in the chart. And that every single one of the films is of diagnostic quality. So the dental record must have informed consent from the patient stating that they have given consent for the treatment that they are about to receive. The number and type of radiographs that were exposed on the patient, and the rationale for exposing the radiographs. We don't just take radiographs because the patient came into the office. There has to be a reason for taking the radiograph. And the diagnostic interpretation for the radiograph. So was there an anomaly on the radiograph? Was there decay on the radiograph, an abscess? Was there no pathology listed on the radiograph? There has to be some sort of diagnosis after the radiograph was taken and read by the doctor. And with digital file security, an advantage of digital files is that they can be sent over computer networks. But before doing so, you have to check with local, state, and federal regulations about patient confidentiality. So certain private networks or virtual private networks or VPNs, you're not able to send files over because they don't have this privacy or the security that they need so that the information can't be hacked. So you have to check and make sure that the sender is able to receive the information. So it's not as safe to send things via internet. It's safer to send things via fax. So that's why offices still have fax machines in them. Typically, if you're sending something outside of your office or your network, you're going to send it via fax. Like if it's coming from one dental office to another, it's going to be faxed or mailed versus sent via internet or email, because it's just the security is much higher that way.